Hi, my name's Lou Buckle. I've been asked to film this vlog to tell you about my personal experience of shielding during COVID-19. I've worked for the Trust since August 2009 and moved across a few roles during this time, most recently rejoining the emergency department as an advanced clinical practitioner 1 week before NHS England decided that extremely clinically vulnerable persons would be required to shield. I was aware that I was likely to be contacted by NHS England at 11 p.m. the day before, due to a tweet from Asthma UK detailing the drug combinations that would qualify severe asthma. Having just arrived home from a shift in the ED, this was the last thing I wanted to read. The text message arrived the next morning with the letter a couple of days later. ED were quick to establish that I'd need to work from home for the 12 weeks, and within a couple of days I had remote VDI access and awaiting a job list from the department. I was rung by Gav Hitchman, Director of Nursing for Medicine, and asked to set up a nursing staffing hub with another senior nurse who was also shielding, with a team that we were due to build being led by Sandra Atwood. I had no idea how busy those first few weeks would be, driven by the knowledge that we wanted to be able to respond to changes in nursing staffing as quickly as needed as the pandemic developed. The first few weeks, it seemed that shielding would be fine, and that 12 weeks was not that long really. Well, it's what I kept telling myself. However, motivation soon started to drop. I stopped exercising, and it wasn't as enjoyable as the gym. The cause of this was due to frustration and guilt that I was stuck at home. And despite working on ensuring safe staffing across the Trust, I felt I wasn't playing my part, and that after 16 years as a qualified registered nurse, 6 of those an advanced practitioner, I should be in the emergency department. However, that is not what happened, and I shielded for the full 132 days. The impact on my identity of having to admit I have a chronic disease, or sometimes termed a hidden disability, has been hard, and resulting in some significant changes to my mindset. I never believed I had a disability because I'm fit and active. I've never needed adjustments at work to allow me to do my job until coronavirus. In my worst moments, I would have risked anything to return to work. The guilt and loss of self was strong at times. Yet, I have returned to work. This is the start of my 3rd week back with my health intact, stronger thanks to this experience, with new skills and understanding of an area of nursing which I had previously no experience. I can assure you that confinement is not an experience I wish to repeat. I am grateful that we have had British sunshine and the ability to sit on my driveway, chatting to my neighbours with coffee or a gin and tonic to help maintain my sanity. As a nurse, we are surrounded by people, and I have hundreds of conversations a day. To go from that level of human interaction to just my husband, plus the occasional quick chat, was really challenging and felt so weird. Don't misunderstand me, I love my husband and couldn't have done this without his support, but I missed people. I was lucky the ED clinical team, which comprises of junior doctors, PAs and ACPs, had a frequent conference call twice a week during the worst of the pandemic. This allowed me to feel connected to ED. I also gained a new team and support network in the staffing hub. The whole team were chosen because we were all shielding. We all understood how each other felt. I am fortunate to have left shielding with new connections, a new appreciation for who I am in terms of my asthma, but I couldn't be this positive if I hadn't have reached out and asked for help. We are lucky here at Gloucestershire hospitals to have the 2020 hub and Freedom to Speak guardians, line managers, all of which are supportive. I took advantage of Keylink, who were providing free of charge counselling to frontline staff requiring support due to the impact of coronavirus. My husband recognised I needed help, and he was right. Reaching out for help has just made this whole process so much easier. As I wrote this vlog initially, I was nervous about returning to work in the emergency department, and I understand for the others who were shielding, a return to work was a really scary thought. I am so supportive of the individualised risk assessment that was undertaken, with support from my matron, my educational supervisor, my respiratory team and the risk department. I was finally able to restart my ED-ACP role that I'd only done 4 shifts of before shielding started. I've accepted there will always be risk while there is no vaccine. But on the other side, living with severe asthma carries its own risks every winter for me. The precautions and approach to my return has been fantastic. And actually, the last 3 weeks have been amazing.